Good evening, everyone. My name is Bianca, and welcome to the New Teeth Now webinar. I am here tonight with Dr. Kirkpatrick, and tonight we're going to talk all about full mouth dental implants and all that New Teeth Now has to offer. Dr. Kirkpatrick, let's get started. How are you doing today?
Yeah, good, Bianca.
Good.
It's going to be exciting tonight.
Yes.
We got some new videos to show tonight.
Yes, we do.
So we are, like Bianca said, we're going to be talking a lot about implants. Thank you guys for taking time out of your day to be with us. And we'll just jump right in because I'm sure you are ready to hear all about it. So a little bit about me, just so you know who you are listening to. I'm originally from Kentucky, did all my school at the University of Kentucky, and did my residency at the University of Florida in Jacksonville. And something that I'm very proud of and that you guys should know, and whether you choose to come here for treatment or somewhere else, make sure that the person that's treating you is board certified. That's kind of how we regulate ourselves and make sure that we're staying up to standards and, everything with our continuing education and all the latest and greatest technologies. But make sure that whoever is treating you is board certified. So with implants, they are recommended by the American Dental Association as the best way to replace missing teeth. And for those of you that do not know what an implant is, it's actually the silver structure that you see that's kind of shaped like a screw, or the ones that we use, but there's a lot of different designs that these things are made to represent, but we choose to use this one. We think it's the best one that leads to a good prognosis. But there's basically three parts. There's the implant, then there's a connector that's called an abutment that secures the crown to the implant. And those are very important, especially when it comes down to what we're going to spend a lot of time on, called our New Teeth Now procedure, where we're replacing everything on implants. The abutments are kind of like the thing that secures the bridge to the implants. So they're a very important part of the procedure. And here's how we do that. This is kind of just a sketch of showing a lower jaw, but it's essentially a full bridge that replaces from first molar to first molar. So from chewing teeth on both sides with all the front teeth. Then on the lower jaw, they're typically secured on 4 to 6 implants. And then on the upper jaw, this is showing 4 implants. But I always do it on 6. I was trained to do 6 implants on the top, and I try to put in as many implants as I can to give our patients as much support as I can, so these things can last for years and years. So we will, as Bianca said earlier, take questions and stop, pause different times during the presentation to go over those. And I think we had one question already come in.
Yeah, so this person had several teeth removed years ago and wants to know if they can still get implants.
Yes, you would be probably a perfect patient for this procedure. Basically, there's 3 different types of patients that we see on a routine basis. There's some that, come in with weird scenarios, but for the most part, there's 3 different types of groups of patients that we see. People who are missing teeth, like maybe the person that asked that question, and been missing them for a long time. They've just been wearing dentures and tired of dentures and want something that's more fixed and that doesn't come in and out, and something that would look good and that they can chew and basically eat anything they want. This second group of patients that we see would be people with just bad teeth. People that have a mouthful of bad decay, and to try to fix them, if fixing them would be an option, would entail lots of root canals, lots of crowns, lots of time, lots of money, and going through all those procedures, there's no guarantee that they would last. So those patients would be good candidates for this procedure. And the third type would be people that are just severe periodontal disease, so gum loss, bone loss, gum loss, and they get into that wheel where they're going in for cleanings every 2 to 3 months, and they have continued bone loss, and the only way to truly cure that and get rid of it is just to remove the source. So you take out the teeth, that gets rid of the source, the infection clears up.
Right.
And what's cool about that is that we can do that in one day. So we can take the teeth out and essentially cure the infection in one day and put the implants in and give the patients new teeth that they leave with, which is
awesome.
a really cool thing to be able to provide for patients. So we'll go over a lot of before and after pictures tonight. And I'll go through kind of fast because I know you guys don't want to like sit and stare at a before and after picture of some of the patients that I've treated. But I do think it's important for you to see them so you can actually see the results, like real people with real situations who have had this procedure. And all these patients have been treated by me. So, you know, with this guy, he just had a mouthful of bad teeth and he'd been thinking about having something done for a long time and he wasn't sure what to do. He didn't want dentures, even though that was recommended to him in the past. So he came to see us, and ultimately we took out all the bad teeth, which was all of the teeth, put in implants, and here's his side-by-side of his before and after. And that's a huge difference.
Yeah, he looks great.
And, you know, he was a very outgoing personality, just super nice guy to begin with. And it was kind of fun watching the change, how it even made him more like, I mean, he'd walk through the doors and he had on, you know, matching shirt and hat every appointment. And he was just smiling. He was telling everybody about, you know, what he'd gone through and how much it changed him and, you know, wanting everybody to see his pretty smile. And I would too. I mean, look at that.
Yeah.
So, you know, it really does affect patients in ways that we'll probably never understand because we don't go through it, but it's cool to watch them kind of on their journey with their teeth. But so this lady, car wreck when she was a teenager, hit the steering wheel, knocked out, broke off a lot of the upper teeth, and she had this kind of appliance that a dentist had made her that just kind of snapped over her teeth and replaced, and it just basically for cosmetics, but it was something that she could put in and it looked like she had teeth, but she never felt good about it. She couldn't eat really with that in, and she came in, we took everything out, all the broken roots, all the bad teeth in the back, and that's her before and after. And that's just, I love this before and after, and I love her story. She's a really nice, cool lady, and you know, that's just a big transition.
Mm-hmm. And this is Terry, and he actually works at the dental lab here at New Teeth Now, and he had suffered from a lot of different dental problems. So we're going to listen a little bit about his story and why he decided to have New Teeth Now.
I've had a go-kart accident where I flipped over, actually smacked my face, and knocked all my teeth so they were just dangling out of my mouth. My name's Terry McCook. I've been a dental technician for New Teeth Now for the last 4 years, making people's teeth here every single day. When I have people's models in front of me, I'm like, this guy's teeth are nicer than mine. I was a truck driver for a few years. Got my head stuck between a loading dock and a truck and a dresser. That sliced me here, but erupted these teeth. My teeth used to be fairly straight across the bottom, but these, it all erupted. Most of the people I hang out with, I bike ride, I kayak, I paddleboard. You know, I'm 20-something years older than most of these people. I keep up with them. I don't have the smile to say, hey, look, I'm young. You know, when I smile, it shows more of my age. And I'm looking to take the journey to be a New Teeth Now patient.
All right, Jerry, we're going to do 2 pictures first.
Okay. Jerry, how you feeling?
I feel good. I know I'm well taken care of. I feel very comfortable. It's like family's putting me to sleep.
Do you trust this family?
Yes, I trust this family more than I trust my family. Everyone in here is very professional. Surgeons are absolutely the best I've ever seen anywhere. I see the results from people every single day. And I'm very excited to get some new teeth now.
All right, man.
I don't want to look.
Huh?
I don't want to look.
No, yeah, you do too. You gotta see what they did upstairs.
Wow.
Hey.
Oh my God. Wow, I love it. Oh my God. Whoever did him was an artist.
So you got to see a little bit about Terry, and we'll come back a little bit later so you can see his full reveal and how it really has changed his life. But yeah, we're looking forward to that. So.
Yeah, no, that was great. I love that video, and I love, I get to see Terry all the time because he works here, but it's really cool to kind of see on a day-to-day basis how, how he went through the recovery, how he feels about the teeth, and, and he gets to make his own. Which
I know, that's so cool.
It's a really cool story,
He gets
too.
to make his own teeth.
Yeah. So he cannot complain at all about the appearance, Like
It's exactly how he wants
I can kind of give him the little layup and a perfect little foundation with the implants, and then he gets to make his teeth. All right, so we'll go back to our slides, and why do people do this procedure and do come in for the New Teeth Now procedure? Number one should always be to restore total body health. Everything else kind of comes along with that. So, with the self-confidence, definitely, they're going to look great, but everything should be about being as healthy as you can be. Definitely, they can help you bring out a smile. We see patients all the time, and, I'll tell them during the consult, and I'm just looking at different things that I need to know before surgery, like lip position and other things on how they move their mouth and move their lips, and when they're talking, when they're smiling. And I always say, like, oh, well, give me the biggest smile you can. And it's really common for patients to say, well, I don't really ever smile. And you can tell, like, it's really hard for them to give me that full blown out smile. So that is one of the things that this can help. When the teeth look good, it's easy to smile.
Yes.
Definitely improves your ability to eat, and hopefully, if patients that are having a lot of pain with decayed teeth or broken teeth, then that pain's gone, so you can eat what you want with no pain. You're asleep during the entire procedure, as you saw in Terry's video. And then the postoperative pain level, it should surprise you. It surprises us all the time. We give you pain medicine, but it's very common for our patients to tell us that, well, you gave me all these pain pills, but I only needed 1 to 2 pain pills, and then they converted to like a Tylenol or Advil. So that's a really good thing to hear from our patients.
Yes.
That, we do all this work, and the patients are expecting to have a lot of pain with this, and when they don't, it's cool. So the oral body connection, there's a lot of research that's been done on this in the past, and there's still research being done on this. But the mouth is essentially the gateway to a pretty awesome creation. It's the first thing that encounters the air you breathe and the food you eat, which both of those keep you alive. But we know that periodontal disease is a really bad thing to have. It's a chronic, could be a low-grade infection, could be one that is really severe and rampant and really attacking fast. But essentially, it's periodontal disease, the infection that is constantly there, that your body's constantly fighting, and that can have a direct effect on the cardiovascular system, which increases your chance for heart attack, stroke, diabetes, osteoporosis, respiratory diseases. I mean, you can read the list, but one of the big ones, and what it comes down to, is that it does affect the overall body, which is forcing your immune system to continuously fight an infection every minute of every day, which can reduce the effectiveness of your immune system, which ultimately can shorten your life expectancy. And here is a picture of what periodontal disease really looks like, up close and personal. And when, this is the same day, this is probably an hour after I started the procedure, the teeth are out, periodontal disease is completely gone, and 6 implants on the top. And that is...
It's already looking healthy.
It is. That's what I was going to say. It's just healthy tissue that now can start healing and getting back to, basically hitting the reset button. And this is him. This is, I think it's about 5 weeks after. That's typically when I take the teeth out for the first time. But that's just beautiful tissue there. No infection, no redness, no swelling, no drainage, and good healthy bone level around all those abutments. And that's before and after. So if you want to be truly healthy, you have to think about every part of your body, including your mouth. So another before and after, great lady, great story. And, if you look at that, let me go back to that before and that after. It's just a huge difference. And to know that we can help a patient like that and to help change their life, where she doesn't really have to think about her teeth anymore. She just goes through life every day thinking about life, not teeth. Mm-hmm. That's a great thing. So, like the question that we were asked earlier about they've been missing teeth for a long time. Well, here's a patient that has had a denture for years and years and just tired of having something removable. So we put in implants, fixed bridge on top, and the denture got to go basically in the trash. So it's definitely a procedure for patients who have been missing teeth for a long time. So who's a candidate? Like we talked about before, if you have no teeth or you're unhappy with your dentures, you're definitely a candidate. Mouthful of bad teeth, have severe periodontal disease, especially if you've ever been told that you don't have enough bone for implants, you need to come in and see me for a consult. I think it'd be well worth your time. I've been here for going on 13 years now with this practice, and I've never met a patient that I couldn't do this procedure on. So before, after, the before picture, bad periodontal disease, just had a hard time keeping up with cleanings and everything else that comes along with taking care of his natural teeth. And ultimately he was in this position that he needed dentures and he didn't want anything removable. So we took everything out, put implants in, and that's his after.
And he looks so different.
Oh, I
Got
know.
a new hairdo.
New hairdo, new teeth.
Mm-hmm.
And look at that smile. And that's
It's
typically what
very
we see.
genuine, yeah.
The one is before. He was one that was tend to give me a smile with his before, but there's a difference when he's that happy with his after teeth.
Yeah, you could just tell.
So Zygomatic Implants, this is a tool that we have that really helps us treat patients who have been missing teeth for a long time or just have a lot of bone loss, or their sinuses have expanded and they have no bone in the upper jaw. We can still treat those patients very easily with something called Zygomatic Implants. So we totally bypass the areas where you don't have a lot of bone and we anchor them into the zygoma, which is your cheekbone. It goes into the lower part of the cheekbone, and it allows us to still do this procedure in one day with no bone grafting and not waiting on grafts to heal, not having to take bone from a patient from somewhere else, like the lower part of the leg or the hip. They've been a great tool to have here. And I'll show you another patient that I did these on. She had a ton of bone in the front part of the upper jaw, but no bone in the back. And that's what we're talking about with the Zygomatic implants. You can tell those back implants, they're longer, they're angled toward the back part of the jaw, and they anchor into the cheekbone. But it enables us to do this procedure in one day without having to do sinus lifts, without having to do bone grafts in the sinus, and you don't have to wait, 8 or 9 months.
See if it even works.
Right. Oh yeah, that's the other thing. You don't have to wait 8 or 9 months to see if the bone graft is going to heal, and there's always that chance, like Bianca said, that to see if the bone graft's even going to work. Sometimes you do the bone graft and everything goes great, and you still heal with not enough bone for implants. With zygomas, they're going to work.
Great.
So the New Teeth Now Total Facial Makeover. Another big part of my practice is I do facial cosmetics, and that pretty much entails everything that you can think of from neck up. So Botox, fillers, they're not really surgical procedures, but we do them and try to augment some of the implant procedures we do. But chin and cheek implants, brow lifts, eyelid enhancement, facelift, neck lift, and rhinoplasties. So one of the cool things, and it's not listed on here, but we can do lip lifts, and we recently did that on a patient who. That's pictures that we should put in. Like
we need to show it next time.
Yeah. So you have to tune into my next webinar, and I'll show you before and after. Because there's things from a cosmetic standpoint, we can at the same time, a lot of these procedures we can do at the same time that we do these new teeth now procedures. Some procedures we can, some we can't, but lip lift patients, especially who have some of our older patients, as we age, you lose elasticity in the face or in the skin, and so that's what causes the jowls to form, the neck to drop. And the upper lip does the same thing. It loses its elasticity and it's not as tight. So the upper lip length increases.
It looks thinner.
And it makes it look thinner, so it rolls and you don't see as much of the red part. So especially our female patients can have a hard time putting on lipstick. Mm-hmm. So one of the things that we can do when we're doing these implants is do a lip lift. And it's different than lip injections. It's actually just raising and tightening the upper lip, which rolls out the red part of the lip. And it makes a big difference. And it's kind of something that we can just tag on and do at the same time as
you're already under anesthesia, so might as well.
So it's a cool kind of enhancement to do at the same time. And then, another thing that is also a really cool procedure that can be done at the same time as the new teeth nail procedure is CO2 laser resurfacing. So, if you look at this patient, the before picture is she came in here for purely to talk about implants. She was at a point that her general dentist had recommended dentures, and she didn't want to have dentures, so she came in to talk about implants, and found out, through some of our brochures that we had up front that I also do cosmetics, and she was asking me about that. So we ended up taking all of her teeth out, putting in implants, new teeth same day, and I did a CO2, which is a carbon dioxide laser resurfacing of her skin. And that after picture is about 3 months after. So to me, that patient on the left, the before, looks like the patient on the right's older sister.
Right.
And that's something that when you can get rid of fine lines and wrinkles and sunspots and age spots and any of the little imperfections in the skin, it basically turns back the clock 10 or 15 years. I mean, it doesn't take you back to from 65 to 18, but if we can take you from 65 to 50, I think that's a great that's a great thing to do. So facelift, definitely a huge difference between the neckline. If you look at where her lower jaw and her jawline meets the neck, that's enhanced without having that true, she still looks natural, without having that true old plastic surgery wind tunnel look. Another facelift, or this lady actually had a brow lift, facelift, neck lift, and looking at her face on, she just looks really refreshed. It doesn't look like that. Nobody would look at her passing her, in Target or Walmart and think that, oh, that lady had cosmetic surgery.
She just looks natural.
Side, that's a huge difference.
Yes.
But she still looks very natural and age appropriate. CO2 laser before and after just kind of gives her that bright look. She's got a glow to her now. Chin implant, these are something that's a great tool that we can also do at the same time as the implants, but that's a big difference if you look at her. She has to strain her lips to get them to close in her before picture. She's got dimpling, let me see if I can get the arrow working. Dimpling of her skin here, and that's her muscle trying to contract to get her lower lip to meet the upper lip. Now she doesn't have that, and that's a 45-minute chin implant. So, with the new teeth now procedure, dental implants, I've had patients ask me this before, but I think it's a cute question, but they do never need a root canal. You know, they're not real, they don't have a nerve. So they're not going to do a root canal, they're not going to decay. They're very easy to maintain. You brush them just like you do natural teeth. You do need to go get cleanings, though. That is important for you to know. You can't get these implants in and the new teeth on and all of a sudden just disappear. Yeah, and never brush your teeth and never go to the dentist. You know, it's still really important to keep up with cleanings, and you go get them professionally cleaned every 6 months. You know, and it's
just
a
like
super
normal dentist.
Yes, the same way I do with my natural teeth. So I guess you don't have to, but you want to go and get them professionally cleaned if you want to keep your implants. That's kind of the important part. So think about that. Before and after, you know, and this lady, just a great lady, a big time before and after, you know, especially appearance-wise.
And I was going to say, she'll talk to any patient. If they want to talk with her, she's open to talk.
Let me go back. So, yeah, she's one of our patients that, you know, volunteers. Like, if anybody has questions, they want to know, like, the real deal about the recovery and, you know, talk to somebody who's actually been through it. Mm-hmm. She's offered, it truly affected her in such a way that she wants to talk to people about it. Yeah. So we've got another follow-up. I'll let you talk about Terry again. But
so we're just gonna see, you know, we stopped at the point where he's about to see his new smile, and so we're just gonna finish that video and kind of see how it's really affected his life since having the new teeth now procedure.
I've had women say on dates like, "What happened to your teeth?" or "So you're gonna get your teeth fixed soon?" And wow!
Hey!
Oh my God! Wow! I love it. It's been 2 months since my procedure. I feel great. I feel wonderful. I love my smile. This was the best thing that happened to me in a very long time. I can't say enough good things about Dr. Kirkpatrick. He's not Dr. Kirkpatrick the surgeon to me. He's Dr. Kirkpatrick. I could talk to him like I'm talking to you. I don't think anyone in the world could treat me as well as he treated me, you know, because I'm very happy. I've been telling you this the whole time. I am so happy with my implants. I look at before and after pictures and I'm like, I changed so much just with this procedure. I have more confidence because I would never be so outgoing the way my teeth were. And now I talk to everyone. Right now, summertime, I'm still a big paddleboarder. Hey, Christy, you ready to go out?
I'm so ready.
Awesome. Kayaking, paddleboarding, mostly paddleboarding now. It's my new sport. I paddle with 2 young women, very nice smiles. I've had a lady on the river saying, "You guys, all 3 have the greatest smiles." And I'm telling you, I got so many people. I'm a paddleboarder. I'm always on internet sites that, you know, Facebook sites and Instagram and a lot of Facebook groups. And I get a lot of compliments on, "Oh, you got a great smile," you know. "Oh, I love seeing people smiling when they're paddling." And I smile all the time. I get more compliments on dating sites because of my smile. And all of a sudden, everything has changed. It was like hit after hit saying, "Oh, you got a great smile. You know, your smile makes you look quite young." And they think I'm 35, not 55. I eat that stuff up, you know. Yeah. As gorgeous as I thought I was, I'm twice as gorgeous now.
So that truly is amazing. Like, he's just living his best life, just enjoying time, meeting new people, talking with new people. It's really incredible.
So, you know, I was laughing during the end of that video because Ted, who is here with us tonight, is, you know, he's a very big part of our team with filming and helping produce a lot of the commercials, and I know Terry smiling like that. Come on, Ted, you know he made it. I don't know how many takes that took to get that little clip. To see Terry paddleboarding with just a permanent smile, that was pretty priceless. I love it. Okay. So back to business. One big thing that we do here that we're really proud of is everything is under one roof. So when you come in, it's a big building, but it's got a small office feel to it, because you're really not going to come in and talk to somebody during a consult and then maybe see a surgeon, maybe not, go to a restorative dentist and maybe never see that person again. You're going to come in, you're going to meet with one of our implant coordinators, and you're basically their patient. And then you'll meet with me, and you're my patient. So I'll be the one doing your consult, I'll be the one doing your surgery. You'll meet with one of my restorative team members, and they're going to be the ones that are seeing you to make the teeth. So you're you're
the same people.
You become part of my little surgical family, and that's important from my standpoint, and it really should be important from the patient standpoint, because everything is done here. You're not coming to this office for surgery and then shipped somewhere else to have the teeth made, and then going somewhere else to have a lab look at you or have the teeth made. The surgery's done here. The teeth are made here. I mean, the teeth are made here. We have the lab in-house, so everything is made here. Terry's in-house, so it's really beneficial for patients when the lab tech that's going to be making your teeth can come out and see your real face, your skin, your shape, even looking in your mouth, because that helps them get a better idea of tooth position, tooth size, tooth shape, and to be able to talk to the restorative dentist and find out what they really want and try to give them that product at the end of the day. And that's something that not a lot of places can offer and say. So the procedure is done in just one day. The temporary teeth, they're acrylic, so you get 2 sets of teeth. We haven't really talked about that yet, but the teeth that we put on the day of surgery, we call them your test drive set, but we try to get them to look and feel like you want your final teeth. When it's all said and done, at the end of the day, that's what you want. And you wear them for 6 months, because that's how long it takes the implants to heal. And there's a really good reason that we do it that way. I don't really know of a better way to do it. There's other practices that they say that they put their teeth on either the final teeth later that afternoon, or the final teeth the next day, or the final teeth in 2 days. And there's all these gimmicks out where it's we final teeth tomorrow, final teeth in 48 hours. And they sort of talk about why wait 6 months to get your final teeth? Well, I've been doing this for a long time, and I know how the gums heal. And there is no way to predict how much your gums are going to shrink. And they're going to shrink. So when patients come in, we do the surgery. We put the temporary teeth in the day of the surgery. And if this is your gum level, the teeth go in that day butting up against the gums. Well, as your gums heal and get to a happy, healthy state, they shrink. So you're going to get a space in between your gums and your teeth. And you're not going to like that. And you're going to tell me about it like it's the first time I've ever heard it. And I'm going to tell you that, remember in the consult when, we talked about that. You're going to get a space there. You're not going to like the space, but it's something that we know that's going to happen. And it's very easy for you to clean. I actually like for you to have that space there when everything's healing. But then when it comes time that the implants have healed and your gums have stabilized to their new healthy level, that's when we make your final teeth. And they're made out of zirconia, which is the best material that, in my opinion, that you can make these out of. They're very, very cosmetic looking. They're very, very strong. And that'll be made to go up and butt up against your new healthy gum level. And it closes that space. So when you're finished, you're finished. You don't have to think about, why did my final teeth put on 2 days after surgery? Now I've got this big gap in between my gums and teeth. What if you don't like what they look like? And and if you don't like, what you picked and you wanted to change them, you're kind of stuck with that. So you have to pay to get a new set made. Or sometimes they'll say, oh, well, we're just going to add some material to close the gap. That may last for a little bit, but that's something that's not going to be permanent. Where if you can wait, let your gum level heal and shrink, and then make zirconia that is the correct size and shape to fill in the gaps, and you get them to look the way you want, then you're done. Mm-hmm. Then you don't have to think about it anymore. So in my opinion, you need to have the 2 sets of teeth, and the final set needs to be made after everything is healed. So when you come in for the consult, it's about an hour appointment, and you'll get it's called an ICAT, but it's basically a CAT scan of your face, and we go over that together. We develop a treatment plan from looking in your mouth, a quick little clinical exam, and looking at the CAT scan, and that's how we develop a treatment plan and tell you and show you and go over with you sitting there looking at the same images I'm looking at, how we can get you to your goal. So our implant coordinators, Shauna's in the blue shirt, Debbie's in the black blazer. They both are super at their job. They've been doing this for a long time. Half the time I come in the room and, I start going over the surgery and the procedure, and, the patient's just kind of like yawning, like I'm boring them to death. And it's because Shauna and Debbie have already gone over everything with them. And I'm basically repeating what they've said because they've been doing this for so long. They really can help the patients out and, give them a really good perspective on what we're going to do.
And they'll lead you through the whole process, so they're your point of contact.
Oh yeah, and they're great. Our restorative team, Dr. Nafala and Dr. Dibbs, both are excellent at doing this. And what they do is they're basically the magic, the magicians of the procedure that makes the teeth. They make your temporary teeth. They listen to you about how you want the teeth to look, and they make the temporaries, they make the finals, and I do kind of the groundwork and give them a foundation to put the teeth on.
And we're gonna listen to a video next. Dr. Dibbs is going to tell us about his work and what he does with the dental lab.
One of the things that really sets Florida Dental Implants apart from other offices that are doing full mouth implant reconstruction, I have my own laboratory here on site that myself and the other restorative doctors are able to use. This is invaluable. Having the ability to work so closely with my lab gives me the ability to better help my patients with the emotional side of it as well. A large number of the patients that come to us for treatment have had severe dental problems for many, many, many years, sometimes dating back to childhood. Because of the emotional concerns that they have, we really have to spend the time with the patient. That you can't rush anything. And we need to have ample opportunity to have questions asked and answered. Having my own laboratory here on site, this is invaluable, not only in terms of having the control over the quality of the product that we're making, but the ability to, if I've got a question with the patient about, can we make this change? Is this going to be feasible? I can go across the hall, get one of my lab technicians, and all of my lab technicians have been doing this for many, many years, bring them across the hall and they can talk to the patient themselves. So we eliminate the need for me to try to interpret the patient's concerns and questions and needs in a phone call or in a note. They can speak directly to the patient.
It was so important to me to have everything under one roof. There's no waiting. That is the advantage of having the lab on site. And they are so proud of their work that they come out to see the product. These are not regular people with regular jobs. These are master artisans that create. They truly are artists, and they're creating beautiful smiles.
It's like nothing I've ever experienced, and I don't know of any other office that's like this.
You just saw a little bit about the dental lab, and it really is awesome that we all get to work together under one roof and we can communicate fully just for the patient, for each patient.
Yes. So we did have another question come in. It was, do final teeth have the same sound as natural teeth? And I'm going to answer it assuming that you're talking about when you bite your teeth together. They've got a different sound, definitely, but I don't really hear patients coming in and complaining of the way their teeth sound when they bite down. I don't think there's a sound when you're eating, but I suppose if you sat and just clanged your teeth together, it would make a different sound because it's zirconia crowns touching zirconia crowns. So I guess it would be louder, but I don't really know anyone with natural teeth or the final zirconia teeth that really go around. Whether you have this procedure or you have natural teeth, you really shouldn't be going around kind of banging your teeth together. But they would have a different sound because it's not enamel, it's more zirconia on zirconia. But that's a good question. So when you come in, here is my surgical staff. When you're with me, you're 100% going to see one of these girls when you come in. You'll meet all of them for sure. But it's Sherry, Corey, Amanda, and Alyssa, and they've both been with me for a really long time. They understand what patients go through when they're having this procedure, and they're very good at kind of helping you walk through the recovery and answer any questions you have. When you call in after you've had the procedure, they're good assets for patients who've had this procedure done too. Our anesthesia team, both these two CRNAs are really good at what they do. If you look, and this slide's a few years old, so they've even been doing this longer, but 35 and 25 years of experience doing this. Both of them had started out and worked in a hospital setting for years and years and years, and now have started working with us. So they've done it all. They've done open heart surgery, anesthesia, you name any type of procedure, and they've been a part of, putting patients to sleep for that. So they're very qualified, very safe, and, if they're going to work with me, I have to trust them, and both of these are very good anesthesia team members. Here is the front of our building, and that's a lot of our staff and doctors there. And it's cool to see everybody together when we were taking this picture and just seeing that, that's the team. That's how the whole thing works to get a patient that comes in the door that either has no teeth or a bunch of bad teeth or a bunch of infection, and get them out the door 6 months later with a really good set of permanent teeth. And that's how we get to that point. And it takes everyone in that picture to get you there.
And if you have been with us for the last hour, you've definitely been listening for a reason, and this is probably something that you need. And you are in such good hands with Dr. Kirkpatrick. He can help you restore your total health and happiness. And as you've seen tonight with Terry and the different transformations, you can have that new life transformation as well. So if you are interested in learning more, you can give us a call, set up a consultation. We want to talk to you and answer your questions and just see if we are able to help. So our number is 1-800-615-5838, and we look forward to speaking with you. So thank you for taking the time with us, and thank you, Dr. Kirkpatrick, for being here, and we hope that everyone has a wonderful evening.
If you would like to view more informational videos on New Teeth Now, please click the subscribe button here. Thanks for watching.